Welcome to Live Well, Dream Big. I'm Suzanne Monroe, founder of the International Association of Wellness Professionals, where I've been teaching people how to live a life of wellness, tap into their passion, and go for their dreams for over 15 years. I believe living well and dreaming big starts with ourselves. This podcast will show you how to create a healthy, holistic life, empower your mindset, follow your dreams, and make a big impact. Let's dive in right now. Welcome back to Live Well, Dream Big. Thank you so much for joining me for another episode. Today, we're talking sleep again. This is part 2 in our sleep series, and today's episode is focused on breathing your way to deep sleep. I'm talking with Patrick McKeown, who's a breathing coach and an authority in breathing and sleep disorders. You know, I never heard of a breathing coach before this, but guess what? It's a real thing, and you might just learn something about your own breathing today and how it's impacting your health and your life. In fact, most people have forgotten how to breathe properly, and it's leading to not only restless nights and poor sleep, but stress, anxiety, and even other health challenges. So be sure to listen into this informative episode, share the show with a friend. All right, thanks for tuning in to Live Well, Dream Big. Let's get started. Welcome, everybody, to today's episode, Breathe Your Way to Sleep. I'm really excited to be here today. I'm talking with Patrick McKeown, who is a foremost authority in the field of breathing. He was educated at Trinity College Dublin, completing his clinical training in Russia. And in 2002, he was accredited as a breathing coach by renowned physician, Dr. Konstantin Buteyko. Since 2002, Patrick has helped tens of thousands of people worldwide. His work focuses on breathing pattern disorders, sleep disordered breathing, and anxiety. And his newest book, The Breathing Cure, just came out. It contains comprehensive research into breathing science, and it offers practical applications for breathing exercise in a variety of health conditions. It provides a unique series of exercises for adults, children, teens, so for everyone. And The Breathing Cure really develops ideas shared in his first book in 2015 called The Oxygen Advantage, which includes breathing exercises to increase oxygen delivery, improve sleep, and boost concentration, and has been called the definitive book on breathing. We'll post the links to those books below in the show notes. But hello and welcome to Patrick.
Thanks very much, Suzanne. Pleasure to be here.
Well, I'm very excited you're here today. And, you know, sleep is such an important wellness topic, right? I mean, there's so much information out there about sleep, though, and yet tying it into breathing and how we sleep is, I think, new to a lot of people. So I'm really excited we're diving into it because it's not always the first thing that you think of when you want to improve your sleep. So I'm really glad we're talking about that topic today.
Yeah, and I think it should be the first thing that we should be thinking about. It's really, breathing and functional breathing in and out through the nose as being the elephant in the room when it comes to helping with sleep disorder breathing.
Well, that's interesting to hear you say that. And I'm kind of curious to hear more about that as we talk today. But, I do kind of love to start out just hearing like a little bit about your story. It's always fun to hear what our guests, kind of what your background is and really what led you to be doing what you're doing today. I mean, helping people to sleep better and breathe better. How did this all come about for you, Patrick?
I was a child, like many other children, growing up with asthma. And if you have asthma, you don't just have asthma. You're more likely to have a stuffy nose. And because of having a stuffy nose, I was a chronic mouth breather. So my breathing pattern was very much in and out through the mouth. And that can be evident, not so much from an awareness back then, because most people weren't paying attention to whether a child was breathing in through the nose or in through the mouth, but from family photographs. I do remember some instances. I remember being hospitalized with an asthma attack in 1994, and 2 doctors came in and they said that he breathes both through his nose and through his mouth. So I was an individual who was caught for breath. I would have had a fast respiratory rate, upper chest breathing, irregular breathing pattern. And it didn't just affect my lungs, but it affected my sleep. So at university, which I really struggled through because of poor concentration and attention span as a result of undiagnosed sleep apnea. But the only reason that I believe I had undiagnosed sleep apnea is because students in student dorms were telling me that I was stopping breathing during sleep, and they were concerned. So I graduated from university, and in 1997, I read a newspaper article about the importance of breathing in and out through the nose and about the importance of breathing light. And this was something that caught my attention because I was doing neither. And I often, as well, practiced, when I can remember, taking full big breaths because that was the general idea back then at the time. I remember going into doing one of my exams at university, and I was pretty anxious going in because if you have dysfunctional breathing patterns and you're breathing faster in upper chest, you're already in that hyper aroused state. And I took a walk before going into the exam hall, and I took these full big breaths for about 3 or 4 minutes. And I remember walking into the exam hall and sitting down, and I was all over the place. I was lightheaded. I was dizzy. I never realized that what I had done was absolutely the worst thing possible. I never realized that the more air that we were breathing, that it caused my blood vessels to constrict, that it caused reduced oxygen delivery throughout the organ, including the brain. And this is why I felt all over the place doing the exam. There are many ideas out there about breathing, and I think it's very important to break them down. But I was lucky enough to come across it back in 97. And I used a technique to help decongest my nose. You can unblock your nose in 5 minutes by simply holding the breath. And I'll go through this exercise with you. I also practice breathing less air, doing the absolute opposite to what's commonly being taught. And I was able to improve the temperature of my fingers. I always had cold hands and feet. But because of my chronic hyperventilation, because of my faster and harder breathing pattern, the blood circulation was impeded and I had cold hands and cold feet. I always had fatigue. I got my grades in school, but it took a lot of work. It took 10 or 12 hours studying a day. So by practicing breathing exercises and by taping my mouth closed during sleep. So the first night I taped my mouth closed using 1-inch micropore tape, and I used a nasal dilator across my nose to help keep the nose open. And the first morning I woke up, I didn't really notice much of a difference. The second night I taped my mouth again. And the second morning I remember waking up with the best night's sleep I had in about 15 years.
Wow.
So it was about 2 years later that I decided to change careers, and I trained again in Russia with a breathing technique called the Biochemistry method. And we've since now very much expanded from the Biochemistry method. We use about 26 different breathing exercises to change states, to help open up the airways, to improve sleep patterns. And yeah, I think it's very important for people to have a basic understanding of breathing because dysfunctional breathing is relatively common in the population. It's probably about 20% of the normal population. But in the anxiety and panic disorder population, it's as high as 75 to 83%. In the people with lower back pain, it's 50%. In people with asthma, the literature shows it's 30%, but I would believe it to be higher. So breathing is a behavior. And it's a behavior that can change as a result of factors of modern living, stress, trauma, excessive talking, for example, the food that we eat, lack of exercise, the postures that we sit during the day. And these can all impact our breathing. And I would go first and foremost that the very foundation of good breathing patterns is in and out through the nose. The mouth has no role whatsoever when it comes to breathing. Is there any part of the mouth that is dedicated to conditioning the air as the air is drawn into the lungs? And the answer is no. All of the functions when it comes to the breath are implied by the nose. The nose, the nasal cavity, is able to condition and warm and moisten air. There's a gas called nitric oxide that's released from the paranasal sinuses into the nasal cavity. And also, by breathing through your nose, the air that's drawn into the body is slowed down. And this is very important for mental states, especially the exhalation. On the other hand, mouth breathing is faster breathing because the resistance to breathing is less during the day through the mouth than it is through the nose. Now, during sleep, mouth breathing imposes a resistance to your breathing that's 2 to 3 times that of the nose. So you are more likely to have sleep disorder breathing by breathing through the mouth during sleep. So mouth breathing is faster breathing pattern, and it's also a shallow breathing pattern. And if you look down at your chest, and if you take the breath in through your mouth, you will typically see that mouth breathing engages a higher breath, that you're breathing more using the upper chest. Now, when it comes to states, when we breathe fast, and especially in the exhalation, as would happen during mouth breathing in rest and sleep, the brain interprets that the body is under threat. So if we look at the research over the last 30 years, and if we look at the research at heart rate variability and vagal tone, and heart rate variability is an objective measurement of vagal tone, how can we stimulate the vagus nerve to help bring a balance in the autonomic nervous system? There are a few ways to do it. One is nose breathing in and out, and especially during sleep, because people with sleep disorder breathing typically have reduced heart rate variability. And lower heart rate variability can imply that the body is in too much of a stress state or increased sympathetic drive. So by breathing in and out through the nose during sleep, it helps to reduce the risk of sleep disorder breathing, including insomnia, snoring, and obstructive sleep apnea. By breathing light, it helps to stimulate the vagus nerve. So carbon dioxide is not just the waste gas that everybody talks about. It's not just as simple as taking in as much oxygen as possible and getting rid of that waste gas, carbon dioxide. Back in 1904, a Danish physiologist called Christian Bohr, he discovered that carbon dioxide is a factor in hemoglobin releasing oxygen to the tissues and organs. Now, if you think of the individual who believes that it's good to be taking these full big breaths and taking more air into their lungs, the problem there is that too much carbon dioxide can be removed from the blood through the lungs. So breathing more air than what we need can cause blood vessels to constrict and can also cause hemoglobin to hold onto oxygen more readily. The harder and faster we breathe, the less oxygen that's delivered throughout the body. You can get an idea of this by practicing the opposite. And maybe the best way to understand functional breathing patterns is to ask, how would you breathe when you get into a difficult situation? And I remember listening to a podcast by Dr. Rangan Chatterjee. He's a medical doctor in the United Kingdom. And he was interviewing a brain surgeon. And the brain surgeon said, he says, when I get into a difficult or a tricky situation, the first thing I do is prevent myself from hyperventilating. Now, of course, the brain surgeon knows this. But who else knows this? Who else in the real world, in the corporate world, in the family life, in the sporting world, in the school world, who knows that when they get anxious, that they should exert some control over their breath and especially the exhalation? Because if we respond to a difficult situation by breathing hard and fast, the brain is going to interpret that the body is under threat. And all the brain wants to do is protect the body and to get the body out of there. It's not a time for conscious planning and decision making. It's a time of fight or flight. Now, the same happens during sleep. When we breathe hard and fast during sleep, the brain interprets that the body is under threat and we are aroused from deeper sleep. So we're more likely to have light sleep when we breathe hard and fast. And this can manifest as insomnia. So how should you breathe? Well, if we get into a difficult situation, it's important to be able to bring attention onto the breathing and to breathe in and out through the nose. It's not just about breathing in through the nose, but it's also about breathing out through the nose. There are no animals on Earth who are going around breathing in through their nose and out through their mouth. If it was so useful to breathe out through your mouth, surely nature would have equipped us with that breathing mode, and especially in the natural kingdom. It has not happened. There are only 2 or 3 animals on Earth, and you can imagine of all of the species throughout the world, there are only 2 or 3 animals who actually mouth breathe. One is a dog, and the purpose of that is to regulate the body temperature by bringing air across the tongue so that the dog can cool down. Diving birds, penguins, and gannets can mouth breathe. Healthy animals, including farm animals, will always nasal breathe in and out. And back in the 1970s, there was an ENT, an ear, nose, and throat doctor called Dr. Morris Cottle. And he said that the human nose is responsible for 30 functions in the human body. In 1988, researcher Swift discovered that the pressure of oxygen in the blood increases by 10% when we breathe through the nose. And when we do physical exercise with the mouth closed and we're breathing in and out through the nose, carbon dioxide is higher in the blood, and we know that by virtue of the air hunger. And this helps to improve our circulation and to improve oxygen delivery to the working muscles. Our recovery is better. So the nose is there to protect the upper airways. The nose and the throat and the lungs are protected by breathing in and out through the nose. But if we take cold, dry, unfiltered air into the lungs, moisture is sucked out of the throat, moisture is sucked out of the lungs, we have a harder and faster breathing pattern, and this changes states. So it's very important to look at breathing not just from a biomechanical point of view. Breathing is broader than just focusing on the diaphragm. So if we were to look at breathing, we should be looking at it from three different dimensions. The biochemical point of view is focusing on carbon dioxide. What is the carbon dioxide sensitivity of the individual? Because carbon dioxide is the primary stimulus to breathe. The biomechanical point of view is focusing on optimal movement of the diaphragm. And the diaphragm breathing muscle is mechanically linked to the upper airway dilator muscles in the throat, which are designed to keep the airway open during sleep. If we are breathing through an open mouth, we typically breathe fast and shallow. Fast and shallow breathing is trauma to the upper airways. This contributes to inflammation in the upper airways, narrowing of the upper airways, and is more conducive to collapse. By breathing through the mouth, it reduces lung volume. And as there is a reduction of lung volume, the throat collapses more easily during sleep. By breathing through the mouth, the tongue has to be low or midway in the mouth. And as a result, the tongue is more likely to encroach on the airway, to reduce airway diameter, to increase the risk of sleep disorder breathing. So coming full circle, in terms of sleep disorder breathing and obstructive sleep apnea specifically, the environment has changed since 2013 when a researcher called Denny Eckhart, he recognized that obstructive sleep apnea is not primarily an anatomical issue, that there are four characteristics or four phenotypes in sleep apnea. One is anatomical, but three of them are non-anatomical. The anatomical dimension in sleep apnea is called peak rate, and this is the pressure at which the airway or the throat can collapse. You don't want your throat collapsing at a low suction pressure. You need your throat to be able to withstand a higher suction pressure. How can you help to open the diameter of the upper airway during sleep? Nose breathing, correct tongue resting posture, and also breathing using the diaphragm because of the connection between the diaphragm and the upper airway. The second phenotype is called loop gain. And loop gain can be measured or recognized by the length of time that you can comfortably hold your breath during the day. Individuals with high loop gain, they breathe faster and they breathe harder, and they have an increased chemosensitivity to the gas carbon dioxide. And it means that if they stop breathing during sleep, that as they stop breathing, of course, carbon dioxide is going to increase in the blood, and individuals with high loop gain have exaggerated ventilation to minimal increases of carbon dioxide. So individuals with high loop gain, they stop breathing during sleep, but when they resume breathing with such exaggerated ventilation, the carbon dioxide goes from too high to too low. And when carbon dioxide in the blood is too low, the brain doesn't send a signal to breathe. And this can initiate a central apnea. But when the output from the brain to the breathing muscles is reduced, the output from the brain to the upper airway dilator muscles is also reduced. And I'll just quickly go through the last two phenotypes. One is called arousal threshold, and this is the propensity to wake during sleep. Are you a light sleeper? And if you're a light sleeper, we would call it insomnia. There are two times that insomnia can manifest. One is the difficulty falling asleep. This is often due to hyperarousal or due to worries and stress and an inability for the person to downregulate before sleep. And the second time that insomnia can manifest is due to harder and faster breathing during sleep or a disruption to their sleep, such as snoring or obstructive sleep apnea. We can influence loop gain because we can reduce the chemosensitivity of the body to carbon dioxide by changing breathing patterns. We can influence peak rate by having the mouth closed and the tongue resting on the roof of the mouth to help open up the airway, and also with diaphragmatic breathing to help increase lung volume and cause a stiffening of the throat. We can help to reduce what's called low arousal threshold or insomnia by giving the person the ability to bring a balance in their autonomic nervous system to dampen the sympathetic response and increase the parasympathetic drive. And finally, the fourth phenotype is called upper airway recruitment. How do you get the upper airway dilator muscles to do their job during sleep? They are influenced by nitric oxide, which is an air current messenger, and you harness nasal nitric oxide by breathing in through your nose, also by humming or by breath tolling. And also carbon dioxide has an influence on the upper airway dilator muscles. So that's obstructive sleep apnea. Now, if I was to keep it simple and just focus on snoring, there's two types of snoring: snoring through the mouth and snoring through the nose. Snoring through the mouth goes as follows. So what I would like you to do is to make the sound of a snore through your mouth. And now what I would like you to do is to close your mouth and try and snore through your mouth during sleep. So close your mouth and try and snore through your mouth during sleep. You cannot snore through your mouth when your mouth is closed. So mouth snoring stops once we get the mouth closed. The second type of snoring is nasal snoring or turbulence in the nasopharynx, where the nose meets the back of the throat. And it goes a little bit like this. So now what I would like you to do is, I would like you to take a very soft and slow, gentle breath coming into your nose, and a really relaxed and a slow and a gentle exhalation. And a very soft and slow, gentle breath coming into your nose, and a really relaxed and a slow and gentle exhalation. And as you breathe slowly through your nose, try and snore through your nose. And you will find that as you change the flow of your breathing, that it's more difficult to snore through your nose. Sleep disorder breathing is not primarily due to the anatomy of the airway. If you had a plumber coming to your house, no plumber in his right mind is going to choose the diameter of a pipe without asking what is supposed to go through this pipe. But sleep medicine has focused primarily on the diameter of the airway without giving any consideration to flow. And how you breathe during the day is going to influence how you breathe during sleep. And if you have a habit of breathing harder and faster in upper chest and mouth breathing during the day, you are going to breathe harder and faster in upper chest during sleep. And that's going to increase your risk of sleep disorder breathing. And I'm going to say one thing. You will never achieve mental health unless you get deep sleep. It is the missing component when it comes to depression, anxiety, post-traumatic stress disorder, and ADHD. I'm not saying it's everything, but I'm saying it's a vital component of it. How many people coming in through your door, they have mental health issues, they have depression, they have fibromyalgia, they have chronic fatigue syndrome, they have high blood pressure, they have health issues. We should start looking at sleep, and it's not just about sleep quality. It's not just about sleep hygiene. It's not just about wearing blue light filter glasses, fine. Don't be looking into your screens late at night, fine. Have a cool and airy bedroom, fine. Don't drink alcohol or eat food, etc. That's not where it's at. We have to look at breathing patterns. Now, one doctor who spoke about the critical importance of nasal breathing during sleep was a French doctor based from Stanford Medical School called Dr. Christian Guilleminault, Guimenault. Now, this same doctor coined the phrase obstructive sleep apnea. this same doctor developed the apnea-hypopnea index. He passed on in 2019. He's considered to be one of the founding fathers of sleep medicine. And in the last 5 years of his life, he spoke about the critical importance of restoring nasal breathing both during wakefulness and sleep. Now, despite this, it hasn't trickled down to the general population, and it's likely to take 20 years. Unfortunately, it takes that length of time for something to take hold. But I would say this, it's my observation working with about 8,000 people face-to-face over the last 20 years, that 50% of the adult population wake up with a dry mouth in the morning. You should never wake up with a dry mouth in the morning. And this is regardless of whether you're a child or a teenager or an adult. And if you were to look at children with ADHD, look at their sleep. Children with autistic spectrum, look at their sleep. And let's get both children and teenagers and adults breathing through the nose, but breathing through the nose is only a start of it. We want to achieve functional breathing patterns, and that's looking at breathing from a biochemical point of view, a biomechanical point of view, and also resonance frequency breathing to help bring a balance in the autonomic nervous system, to improve or strengthen the baroreflex and to stimulate the vagus nerve. So I think, Suzanne, there's something very important that has been overlooked in breathing. And one is the critical importance of nasal breathing during wakefulness and sleep. It's not just about how we breathe while we're on the mat, but it's how we breathe off the mat. It's how we breathe when we go for a walk. Does it make sense, even when we do physical exercise, to mouth breathe, to take cold, dry air into the lungs, to aggravate the airways, especially for people with respiratory issues? And also, your diaphragm breathing muscle is not just for respiration, it provides stabilization for the spine, it assists with lymphatic drainage, and it also is connected with the emotions. So the mantra should be is to breathe light, to breathe slow, and to breathe deep. So I use the acronym LSD. Light is about the biochemistry, slow is about the respiratory rate, and deep is about optimal movement of the diaphragm. Now, if you like, I can guide you through exercises if you want.
Well, I think that would be very helpful. You've just shared so much. I know our live listeners, I see people taking notes, and there's just been so information. Here is a question I do have for you, though. It seems like breathing should be like the most natural thing in life, right? Like we're born, we take our first breath. Are we born breathing correctly, and then something happens over time that we lose that ability to breathe correctly? Or are some people born not breathing correctly? Like what's happening there?
If you share the screen, if you can make me co-host, I can show you different papers just to support what we were talking about. In terms of children, some children are born with anatomically compromised airways. And this can be recognized early on in the child's life. And it's especially important because children with a high palate, it's infringing the nasal cavity. And these children can often feel difficulty breathing through the nose. But during infancy, the soft palate and the epiglottis meet. And after a few months of life, the epiglottis drops and the child can actually breathe through the mouth. But during infancy, the young infant is not able to physically breathe through the mouth. They have to breathe through the nose. And they are very dependent on a good nasal airway. But if the child is sucking their thumb in the womb, or it could be down to nutrition, I don't think anybody knows why the shape of the human face is changing. My parents had a very broad facial structure. They didn't have overcrowding of teeth. There was enough room in the jaws for all 32 teeth. Whereas all of the siblings, we had narrow facial structures, and my jaws are set back, so my airway is compromised. So infants, for example, it can happen due to the food that we are eating, and young infants are not eating the way they would have ate 1,000 years ago or 10,000 years ago. You can imagine the food that a young infant was eating back then. They were eating pretty much the same food as adults. They were gnawing on a bone. They were eating maybe hard vegetables, etc. Nowadays, everything is pureed, and this doesn't help to develop the muscles of the jaws necessary for craniofacial growth. Breastfeeding is also not just about nutrition, but it's also necessary for development of the face because, of course, it takes work for the baby to draw the milk from the mother. Tongue tie is an issue that gets overlooked. And this is when the frenum or the string that's holding the tongue to the floor of the mouth is too tight. If the baby is tongue-tied, the child is not able to extrapolate the milk from the mother. The baby chomps on the mother. The mother gets very uncomfortable. The baby doesn't thrive. And instead of the tongue tie being clipped, a bottle is introduced and the baby can take the milk direct from the bottle. But the problem with the bottle is it's not the same as the breast, not just as nutritional point of view, but in terms of the work for the baby taking the milk from the bottle. I think stress is one of the biggest impacts in the adult world, and also lack of physical exercise. If you think of our ancestors, we would have been out doing hard labor, or at least physical movement for much of the part of the day, breathing natural air, unpolluted air, not in stuffy environments. We wouldn't have been talking as well as much as we are talking today. Those of you who talk for a living, you will know that you are exhausted at the end of the day's talking. Why are you so exhausted after a day's talking? It's not because of focus and concentration. I don't have to think about what I'm saying here, just as natural. But what happens is during your talking, we breathe faster, we breathe harder, and that can get rid of too much carbon dioxide from the blood through the lungs. So talking can cause us to breathe too much air, to reduce blood flow and oxygen delivery to the brain. So, I think there's a number of different factors. The food that we eat is one. The idea is about breathing. How many times have we been told, if you're stressed, go and take a deep breath for yourself? What does a deep breath mean? A deep breath should be in and out through the nose, and it should be silent, and it should be light and slow and low. If we want to help to relax the body and mind, breathe in through your nose and have a very, very slow and relaxed and gentle exhalation. Because when you have a slow and relaxed and gentle and prolonged exhalation, you stimulate the vagus nerve, which secretes a neurotransmitter called acetylcholine, which causes a slowing of the heart. And when the heart rate slows down, the brain interprets that the body is safe, and the brain will send signals of calm to the body. And it's just like that surgeon. He says, when I get into a tricky situation, I prevent myself from hyperventilating. If we hyperventilate with faster and harder breathing, the brain, of course, is interpreting that the body is under threat. But if we instead exert some control over our breathing, in through the nose and a very slow and relaxed exhalation, the brain interprets that the body is safe. So I think there's a number of different reasons, and I don't think there's any one, but it's happening fast, and breathing pattern disorders are pretty common out there.
Well, and you talk about, you said, I think earlier, maybe about 20% of the population really needs to be looking at this. But yet, as I hear you talking about this and the amount of people having stress and anxiety today, even more so in the last few years, how do you know if you're someone who really needs to take a look at your breathing and that you actually need to make a change? Are there certain signs besides, your partner says you snore or you're tired at the end of the day?
How could you assess in the adult population if your clients have dysfunctional breathing patterns? One easy way to do it is to use breath hold time. Now, we've been using breath hold time during wakefulness for the last 20 years. It's not perfect, but you know what? It's not too bad either. And breath hold time has traditionally been used as a measurement of breathlessness since 1975. If the breath hold time is greater than 25 seconds, there is an 89% chance that dysfunctional breathing is not present. So what I'll do is I'll go through the test now with you, and don't worry about what you get. So it's not to put you on the spot. And what I'll do is I'll take the camera off you so that you don't feel any pressure, because performance anxiety can hamper the score. So you will need a watch or your phone or maybe your computer just to time your breathing. I would like you now to take a silent breath in through your nose and a silent breath out through your nose, and to pinch your nose and stop your breathing and time it. How long does it take until you feel the first definite desire to breathe? And then let go, but your breathing should be normal. So this is the length of time that you can hold your breath for comfortably. And what you're looking to achieve is that your breath hold time is greater than 25 seconds. So again, you're taking a normal breath in through your nose and out through your nose, and you're pinching your nose, and you're timing how long can you hold your breath until you feel the first definite desire to breathe, or the first involuntary movement of your breathing muscles, and then to let go, to breathe through your nose and to breathe normal. If you have a breath hold time of less than 25 seconds, say, for example, if your breath hold time is 10 seconds, or 11 or 12 or 13 or 14 or 15 seconds, your breathing tends to be faster and harder and more upper chest. So the lower your breath hold time, it's an indicator of faster and harder breathing, both during rest, but also during physical exercise, so that you would be more prone to disproportionate breathlessness. Now, bear in mind that 75 to 83% of individuals with anxiety are prone to dysfunctional breathing, and people with panic disorder as well. And it's very important that if somebody is prone to anxiety and panic disorder, that their breathing is looked at. So what I'll do now is, if you want, I can guide you through just a couple of different exercises to give you a flavor of it. Yeah.
That sounds fantastic. I think see some thumbs up out there. Everyone would like to try some things. I think this will be really useful just for all of our listeners who are listening in and wondering, okay, what can I do to get started? So thank you.
So a very first simple exercise that we would use, especially with people with anxiety, and this exercise can also help to stimulate the vagus nerve. And it goes as follows. It's a very easy exercise. Take a normal breath in and out through your nose, and pinch your nose and hold your nose, and hold your breath for a count of between 3 and 5 seconds. 5, 4, 3, 2, 1. Let go, but breathe in through your nose. And now just breathe normal now for about 10 or 15 seconds. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold. 5, 4, 3, 2, 1. Let go, breathe in through your nose and to breathe normal for 10 to 15 seconds. That exercise can be very helpful for people who have labored breathing, including COVID. And we are working with long COVID as well. The autonomic nervous system in long COVID is taxed. Now, I put out a podcast on YouTube. It's an hour with all of the instruction on long COVID. So you'll find different presentations. You'll find it on YouTube. The main thing is that when you're doing that exercise, it should be no more than half your comfortable breath hold time. Now, you measured your comfortable breath hold time a few minutes ago. With long COVID, we are seeing as low as 3 seconds. If a person has a breath hold time of 3 seconds, they are not able to do slow breathing. They don't have the air to do it. It's too uncomfortable. They already feel air hunger. The next exercise that I'm going to do is to show you how to decongest the nose. And you can also use this with people with hay fever, people with head colds, etc. Don't do this exercise if you're pregnant or if you've got serious medical conditions. You could go easy. To unblock your nose, you need to hold your breath until you feel a moderate to strong air hunger. So what I would like you to do is, and you can test it, because the beauty about breathing exercises is it'll either work or it doesn't work. So what I would like you to do is take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose. Gently nod your head up and down as you hold your breath. And keep going until you have a medium to strong air hunger, and then let go, but to breathe in through your nose. So whenever you feel a medium to strong air hunger, you don't have to overdo it. You just want to push it a little bit. And now we'll wait for 30 to 60 seconds and do it again. And the thing with nasal congestion is that if you have anybody coming in with a stuffy nose, they are more likely to have a sleep problem. Always gauge rhinitis and ask them questions around their sleep. And anybody who's coming in with mental health issues, including depression, also ask them about their sleep. And all too often, it's assumed that the person with depression is exhausted because of their depression. But maybe the person with depression is exhausted because they have an undiagnosed sleep disorder. And when insomnia and obstructive sleep apnea go together, the risk of depression is higher. So again, to try that exercise, take a normal breath, in through your nose, out through your nose, pinch your nose and hold your nose, and just gently nod your head up and down as you hold your breath. Typically, you will do that exercise by about 5 or 6 times. So if your nose doesn't feel free, do it a couple of times, do it 5 or 6 times, and hold your breath for as long as you're pretty, push it, but you have to be comfortable with it. And then check if you feel that your nose is a little bit freer to open up. Now, it is normal that one side of the nose is a little bit stuffier than the other, and that's called a nasal cycle. And they switch typically every 2 hours or so, but not necessarily, they won't switch so well with somebody with a deviated septum. Now, this exercise is not going to help somebody with a deviated septum, but it will help somebody with inflammation of the nose. Now, what I would like to do is to do an exercise involving targeting the biochemistry. And this exercise will involve deliberately under-breathing. And don't worry if you're breathing shallow during this point. The purpose is not to generate or to cause you to breathe shallow throughout the day. But really with this exercise, I'm just going to focus on the biochemistry of your breathing. What I would like you to do is I would like you to have one hand on your chest and one hand just above your navel. And I would like you to pay attention to the slightly colder air coming into your nose and the slightly warmer air as it leaves your nose. And as you feel your breathing, to gently slow down the speed of the airflow as it enters and leaves your nostrils. So take a very soft and slow, gentle breath coming into your nose, almost that your breath in is imperceptible. And have a really relaxed and a slow and a gentle exhalation. And then a very soft and a slow, gentle breath as it comes into your nose. And a really relaxed and a slow and a gentle exhalation. So you're taking a very soft breath coming in and a prolonged and relaxed exhalation. And I would like you to experience it because the objective here is what happens when you breathe less air. What happens when you deliberately take less air into your lungs to the point of air hunger? You're taking a very soft breath in through your nose and a really relaxed and a slow and a gentle exhalation. And as you take less air into your lungs, you feel air hunger. And air hunger signifies that carbon dioxide is increased in the blood. And as carbon dioxide increases, it helps to stimulate the vagus nerve. But it also helps to reduce the chemosensitivity of the body to carbon dioxide. And this way you can achieve lighter breathing and slower breathing. You cannot change the respiratory rate by focusing on slowing down the respiratory rate. Instead, we focus on breathing less air. And by breathing less air, you help to change breathing patterns, the behavioral breathing pattern. But you also help to reduce the sensitivity of the body to carbon dioxide. So I would like you to continue with it for just 1 more minute. Take a very soft, gentle breath coming into your nose, and a really relaxed and a slow and a gentle exhalation. And a very soft and slow, gentle breath coming in. Can you breathe in almost that your breath is imperceptible? And a really relaxed and a slow and a gentle exhalation. And as you do this, pay attention to the saliva in the mouth. Is it less? Is it more? Is it the same? And if you can do this exercise for about 4 minutes with air hunger, you will notice an increased watery saliva in the mouth. And this is a sign that you're stimulating the vagus nerve, or you're activating the body's rest and digest response. Because increased watery saliva in the mouth is a sign that the body is prepared for the digestion of food. And that doesn't happen when we're feeling stressed. That happens when we are relaxed. So there's just a couple of different breathing exercises to give you a flavor of it. Now, we use 26 different exercises. And I've included them all in a new book. And it's not that I'm here to plug it or anything like that. It's just that if you were looking for a resource. And it goes through different breathing exercise for panic disorder, for helping to strengthen the bar reflex in people with diabetes, because very often it's a condition associated with increased sympathetic drive. People with epilepsy, some forms of epilepsy, we can help to reduce the risk of seizures by virtue of changing breathing patterns. Sleep can be a problem in both epilepsy and diabetes, and also lung function. With asthma, with females, menstrual cycle, breathing is different for females than it is for men. And this has been known since 1915. But most of the research done on females has failed to take into consideration fluctuations in hormones. So post-ovulation, when there's an increase in the hormone progesterone, and progesterone is a respiratory stimulant, the carbon dioxide levels can drop by as much as 25%. This can increase pain perception and reduce pain thresholds, can contribute to fatigue, anxiety, and panic disorder. And panic disorder is 2 to 3 times more prevalent in females than men. So it's very important for females, especially with females with PMS, that they can have an increased sensitivity or an overly sensitive reaction to the buildup of carbon dioxide. And it's by doing the breathing exercises that we have to address that. So there are some of the topics.
Well, this has been absolutely fascinating. Just so much information, so much for everybody to take in. And I love that you've provided these useful practices really as a way to check in and see where you are and really take a close look at your own breathing. So let's, in our final few moments of this episode, Patrick, let's move to our coaches talk back time. Mm-hmm. I know some coaches out there have some questions. We'll go over to Heather now.
Hi, Patrick. Thank you so much. It was a quick question. When you go to sleep at night, based on what you said about breathing, is there a way to lie in bed? Like some people lie on their back, some on their side, some on their chest. And I just wondered if you could give a few tips on sleeping in bed, please.
The first thing that we would always say is make sure that you breathe in and out through your nose. Now, many people become a little bit apprehensive when they hear about wearing tape across the lips at night. I'm just going to show you, there's a tape that I use, it's our own tape, but I'll demonstrate it to you, that there is a way to bring the lips together without covering the lips. And this is the children's version, so it's a little bit too small, but it's called Myo tape, and it's named after myofunctional therapy. Now, so this version here is you gently stretch the tape by about 40%, and bear in mind this is the smaller one. And it's elasticated with tension, and it brings the lips together. But if there was an emergency, the person could mouth breathe.
Yeah.
And that then there's no risk associated with that, because if they need to mouth breathe, they do. But by pulling the lips together, it helps to stimulate the orbicular source muscle. when we look at the airway itself, and especially for people who are prone to obstructive sleep apnea, if they lie on their back, there's a risk that the soft palate can fall against the back of the airway, the throat, to cause collapse, or the tongue, or the epiglottis, or the throat itself. So even though lying on the back may be the best in terms of posture, it may not be the best in terms of sleep apnea.
Okay.
And the other thing is that there shouldn't be head tilt. You want to try and get your airway in total alignment. If your head is back like that, or if your head is forward, or to one side, or to the other side, it causes head tilt and it can reduce the airway size. So I suppose we need to have the mouth closed with the tongue resting in the roof of the mouth. And to determine where the tongue should be, you could make the tongue pops like so. So in order to make that sound, your tongue should be resting against the palate. And when your tongue is resting against the palate, it's helping to open up the airway. So I think posture, I think it's very normal that people will switch posture during sleep because the nostril that's closest to the pillow typically gets congested and the other one is free. If the nasal cycle then is working every 2 hours, then after a couple of hours, the person will change sides because the nose is clearing and filling again.
Fascinating. Thank you. Thank you so much. I appreciate it, Patrick. Thank you.
Well, thank you, Heather. And thank you, Patrick, for being here with us today. This has just been such an informative conversation. And I will ask one final question coming in from Lilith over the chat. Is there any such time that you want to take a deep breath anymore? As you said earlier, we're always told, take a deep breath. Are we ever doing deep breaths anymore, or are those just going out the window?
Yeah, it's one deep breath every now and again is absolutely no harm, but it's really what we want to be doing is looking at how should we breathe every day. Now, there are different techniques such as holotropic breathing and Wim Hof method, which involve deliberate hyperventilation. It's if you hyperventilate, and this would be taking full big breaths, maybe for 20 breaths or 30 breaths. It's a stressor. It's stressing the body and mind to make adaptations. And then following by breath holding, that's also a stressor. That if you stress the body and mind, it's very important to recover afterwards with light breathing. I'll give you an example. This morning we had a workshop with our own instructors, and 60 instructors typically tune in on the talk. And one of them is a psychologist working in Italy. And one of his clients was doing hyperventilation exercises for 1 hour. He was doing a holotropic. And following the 1 hour of hyperventilation, he developed a tick spasm in the face, and it hasn't gone away. And this is the effect that we should have a good understanding of what breathing exercises are all about. That some exercises, including hyperventilation and breath holding, and the reason I say it because it's very popular out there at the moment, we have to go gently with many people when it comes to breathing exercises. I'd never be worried with the odd mouth breath. I'm never worried with the odd big breath. But I would be concerned with if a person is frequently sighing or frequently yawning or frequently mouth breathing. And to realize that if you are practicing or your students are practicing hyperventilation exercises, to realize that it is a stressor and to recover afterwards is very important.
Thank you for answering that. And I just want to, again, thank you for being here. Everybody, it's time to breathe slow and low and through our noses. And I'm very excited for your book, Patrick. I've posted some links in the show notes so that everybody can go and check that out. So they can it's really an opportunity to work with more practices and to dive in deeper. So I encourage you to check that out. And thanks again for joining us today.
Thanks so much, everybody. Take care.
Take care. Bye-bye.
Bye. Bye-bye.
Thank you for joining me for today's episode of Live Well, Dream Big. I hope you enjoyed today's conversation. And I want to invite you to take your next step toward living well and dreaming big by downloading the Live Well, Dream Big lifestyle book. It's the ultimate guide to becoming your best self and living life on your own terms. You can grab your complimentary copy by going to the link in the show notes or heading directly to iawpwellnesscoach.com/guide. That's iawpwellnesscoach.com/guide.